Hi, I'm your host, Tannaz, for the Power of the Patient Project. Joining us today, Dr. Britt Berrett, the Program Director of the Clinical Faculty of Healthcare Management at the University of Texas at Dallas in the Jindal School of Management. He is also an executive coach with MEDI leadership with more than 25 years of experience as a hospital president and CEO. His expertise comprises leadership in faith-based, investor-owned, and academic and teaching hospitals. With a Ph.D. in economics, policy, and political science, and Master of Science degree in health administration, and a bachelor's degree in finance, Dr. Berrett has developed leadership theory in strategic planning in hospitals. His interests and focus are on enhancing the business side of hospital operations to improve patients' lives. Dr. Berrett also co-authored a New York Times best-selling book on leadership in healthcare called Patients Come Second, Leading Change by Changing How You Lead. Thank you for joining us today, Doctor.
Oh, it's a delight and pleasure, and thank you for the invitation.
You have many experiences working as a leader, as a coach. In your opinion, what makes a good leader?
Well, that's a great question. Leadership is, it's assumed that you are either born as a leader or you develop the skills through your experiences and trials. And the answer is both. There's some people who have some natural characteristics, traits that allow people to draw to them and allow them to inspire and encourage and move in a specific direction. Others develop those skills over the course of experience. And I'm of the opinion that really anyone can lead. To what degree is the question? And where are you leading them? An even better question.
Right now, there are many obstacles our medical and professionals are facing today. Can you explain what are the main obstacles that we're facing in our healthcare industries, in terms of leadership especially?
Yeah, it's an interesting time. We are post-pandemic. It's inevitable that we will see another pandemic or more healthcare challenges that will really test our strength, our ability, our skills, our ability to come together. And into the future, I think collaboration is the key. There was a time when it was espoused that we have a model of the physician being the captain of the ship, and that the physician gives orders, right? And everyone calls the physician doctor. And those days have gone by. It is more of an interdisciplinary skill that great clinicians collaborate and coordinate. I had a good friend, a cardiologist. He goes, geez, when I started out in cardiology, there was like maybe 4 medications I could give. Now I need a little handheld calculator to tell me what the possible drug interactions might be for a specifically prescribed drug. And, it spurred the conversation about the importance of having a pharmacist on the team to discuss the medications that are administered. When I was running a hospital, on average, every patient had at least 7 different types of medications that they were receiving. Can you imagine how complicated that can get? So I think collaboration, interdisciplinary, working together becomes very, very, very important. And we've seen that in the pandemic. Let's admit, as a healthcare provider, very few people knew where you worked. The only indication they would have was a big blue sign with a big H on it that said hospital. Other than that, not so familiar. Today, our friends outside of the healthcare space know about personal protective equipment and ventilators and ICU bed. We're elevating the awareness of our profession, and we're going to draw in other professions to help us tackle really, really tough questions. So I think the key for future leaders is collaboration and interdisciplinary action.
Collaboration, that's the word that we need to remember, especially in this time of the health crisis that we're facing. Our healthcare industry have been the cornerstone of our society during the pandemic. In your opinion, when you look at the whole healthcare industry, How many percentage of our healthcare professionals do you think have the leadership training?
Oh, training? I
Yes.
think very few.
And why
I
is that?
think,
Why would you say that?
I think we have been focused on the clinical outcomes. Interesting story. So when I took the job at a young age of a 500-bed hospital here in Dallas, I didn't know what I was doing. I honestly didn't know what I was doing. They put me in the job, gave me the CEO title, and honestly, I was winging it. I was doing things that I thought were appropriate. There was no structure or discipline in my leadership. Now, mind you, I had a master's degree. I had a undergraduate in finance. So I started asking, well, what is leadership in healthcare? And there were a couple of biographies about well-known leaders, but nothing on healthcare. Honestly, nothing on healthcare. So when I wrote my dissertation, it was on the convergence of strategy and leadership theory. Does how you lead have an effect, an impact on your strategic outcomes? And the answer is obviously yes, but no one's asked that question. And so I was the first to do that. That was back in about 2007, 2008. Since that time, we have elevated the discussion. And when our book was published in 2013, it became a New York Times bestseller because we were thirsty. It became a USA Today bestseller. When it hit the Wall Street Journal's bestseller list, I knew that there was a thirst to understand how we lead in healthcare and an infusion and investment. So I think today you're seeing a lot more healthcare organizations willing to invest in leadership. How do you lead? What are characteristics that a leader should demonstrate? You might ask, well, what do you mean leadership? What's leadership? I asked two questions that really draw out the answer. I asked this first question: have you ever worked for a horrible boss? Right? What are the characteristics that would describe the worst boss you ever had? And words like micromanager, incompetent, dismissive. Then I spin that 180 and I say, now describe the characteristics of the best boss you've ever had. Inspiring, encouraging, passionate, visionary. That's then the platform to discuss what are leadership traits that great leaders in healthcare must have.
So why do you think the leadership training has not been integrated into the medical and the residency training curricula? And what can we do to increase that awareness?
Well, I think we have been focused on the clinical side, curing the disease. There's a little bit of literature on work teams between nurses and physicians, but very, very little literature on that. We've been focused on, well, how do we cure the disease? What's the cause of the pandemic? All our intellectual capital is focused on that. And it's not until we pause and say, well, how do we move the care from the bench, the research bench, to the bedside? How do you do that? And then you start having conversations about the dynamics of care and strengths and weaknesses. And then all of a sudden, leadership theory and leadership skills are desperately needed. When I was running the 900-bed hospital, our physicians were actively disengaged, and we needed physician leaders to lead the way. And so we created a curriculum of leadership development. We gave them assessment tests. We gave them team projects to work on. We challenged their conventional thinking on interdisciplinary teams. Like I mentioned before, it used to be the captain, the doctor's the captain of the ship. And we'd walk through scenarios where that just was dysfunctional. You talk with a transplant team, they get it. A transplant team orchestrates all the disciplines, and we need that kind of not only behavior, but we need to learn how to use those behaviors. And so that's why I think leadership theory and leadership training is so important for today's healthcare professionals.
Now I wanted to go back to pandemic. It's been a topic that on every day we talk about is affecting our lives, especially on our healthcare front workers, physicians, nurses, people who work in the hospital. going back to what has been the effect of the health crisis that we're going through right now, there has been report our healthcare professionals are facing anxiety, stress. Sometimes they're overworked, overwhelmed, which ultimately can affect their leadership decision making, which can also cause effects on the patients. So, in your opinion or experience, what resources are available to them, to our healthcare professionals, to face those challenges, especially in leadership?
That's such a difficult question because we're looking at this post-pandemic. So everything is retrospective. Now, the term that can be used is organizational trauma. You've heard of PTSD, post-traumatic stress disorder. There are a lot of individuals and there are a lot of organizations that are suffering from that. A constant and reoccurring unknown questions and chaos, concerns about life and limb and safety. We emerge out of this pandemic responding to that. And like PTSD, which is very, very serious, it manifests itself differently in every individual. It just does. And we're trying to figure it out on the individual level. At the organizational level, what we're seeing is organizations that have a clear picture of where they're going, their vision, and clarity of who they are navigating this much more effectively. And so I would suggest that leadership theory in this space has to focus on your mission, your vision, and your values. That's a term and terminology that's used in the business world very effectively. We just haven't ever used it in healthcare. And now we must pivot and embrace this awareness and this engagement on understanding, where's this organization going? Why was it created? What values do we hold to? And so I think you're going to see a lot more leadership theory, a lot more leadership training in the healthcare space. It's imperative.
Yeah, definitely. It's very important. I wanted to ask you about your program, MEDI Leadership, which has extensive experience working with medical leaders. Can you explain more about your program for us today?
Sure. It was an interesting experience. When I joined a hospital in Dallas, there was a lot of dysfunctionality. There's a great book by Lencioni called The 5 Dysfunctions of a Team. It's very prominent, well known. And boy, we checked off all 5. And I was very concerned because our physicians weren't part of the solution. And we had made, I think, administratively some bad decisions that alienated the physicians from the success of the organization. So I cast out a net to say, who's out there who can help us? And MEDI came to mind. They just do healthcare. They just do leadership in healthcare. And they have coaches who have Ph.D s, decades of experience working with organizations. And we brought them on board to help us facilitate the leadership with our physicians. And it was a grand slam home run. We saw our cardiovascular service line come together. We saw our neurosciences come together, co-managed by a physician and an administrator. I'd finished my doctorate. I had finished my 5-year commitment at that facility, and I was going to retire. I was going to go teach. And they gave me a call and said, "Hey, would you like to join our team?" And I said, I'd be delighted. So I enjoyed coaching executives throughout the United States. And we walk through questions that we've discussed today. What's leadership? What are the skills of a great leader? What are the skills and behaviors of a bad leader? How do we bring cohesion together? I do a lot of team building. We'll bring a group of team members together, directors from the IT department or the finance area. And we talk about mission, vision, and values. What are the obstacles to move us forward? It's been said, and I agree, culture eats strategy every time. So you can have the most efficient electronic medical record, a brilliant revenue cycle. Gosh, you could be located in a pristine area. But if you have dysfunctionality at the leadership level, you're doomed for failure. So great organizations are recognizing. They're inviting organizations like MEDI to come in. I work with coaches. I work as a coach with executives, just CEOs. And we walk through how they are functioning, their skills, their attributes, how they're being perceived, what's their brand, We talk about their team members and how they interact. I love doing stakeholder interviews. I sit down with their 9 or 10 direct reports and colleagues and interview them and say, well, tell me about the CEO. How does he or she manifest their leadership? And then I take that confidential information and we sit down and talk about how you're coming across. Many leaders don't realize it. They have just been doing what they've been doing for decades. I'm seeing the younger leaders, the more innovative leaders, more willing to say, I really want to know how I'm being perceived and how I'm interacting with the team. And it's really a joy for me to see an organization elevate their leadership skills. And I promise you, that blesses the lives of the patients. Nothing's worse than a disgruntled employee base, dissatisfied employees. That just is the recipe for poor quality. But if the team's together and collaborates and coordinates and discusses, I think miracles occur. And so I'm proud to be part of that effort. And MEDI is the largest in the healthcare space. So I'm just really honored and delighted to be with them.
Yeah, we haven't seen a lot of leadership program, especially in the healthcare industry. So it's definitely very important. And thank you so much for joining us today, Doctor. I love the word collaboration, and definitely we try to be more captain of our ship, all of us.
A delight to be with you. Thank you for the question.
Thank you.
Best wishes.
Have a good day. Thanks. Bye-bye.